Hi, welcome to Channel 6 TV Community Focus. I'm Kenny Fogle, your host. We've got Jennifer Osborne here with us here from the Health Department, and we're going to talk a little bit about something that's on most people's mind when it comes to health, and that's smoking. Well, Jennifer, first of all, welcome to the show.
Thank you very much.
Appreciate you being here, and this is something that most people I've found that take a one or two approach when it comes to the smoking issue. And most people are passionate on each side, and I assume you're pretty passionate on one side of this issue.
I am passionate about the health effects of smoking. I understand, though, that in Kentucky, tobacco has a big cultural history. So I know there are some issues with that, and people are very passionate one way or the other. So.
Well, like you said, the history is abated considerably over. I know when I was growing up, that was one of the biggest cash crops there was. I mean, I spent years cutting tobacco, hanging tobacco. Never smoked. It's something I just never did. And I tried it a little bit in high school there. And there was two reasons. One, it made me sick. And two is I just never did see the value to it. But some people do.
Right.
And I guess understanding that side of it makes you have to understand that to understand the other side.
Yeah, you have to look at both perspectives. And, I think our biggest issue from the health perspective is that it is the #1 preventable cause of disease and death in the United States. It's preventable.
And when we talk about that, has there been a lot of study of why people start smoking to begin with?
Yes.
So where do you look at it at? Is it in young years? I mean, teenage years, young adult? And peer pressure, what is it?
There are a lot of issues. Peer pressure is one of the biggest ones. If you talk to any smoker, the majority are going to say that they started out in those teenage years, and it was probably because of an influence of a group of friends or a friend. And then you have the issues of how it's marketed. If you look at how tobacco companies market those products, they're not really marketing towards my age. They're targeting those younger populations. If you look at the ads, so we've got peer pressure, and we have very targeted marketing strategies by the tobacco industry. They want the young people to smoke because why? They'll smoke longer. The younger that you can get them hooked on it, the more profit they're going to see.
So when we look at smoking, obviously they don't do as many cigarette commercials now, but they switched over to Juul and other things that they say are less harmful.
Right.
Are they?
That is still debatable, I think. And it kind of depends on who you're talking to. Obviously, the makers of those products are going to say that they're safer, even though there is no evidence behind them to say that they are to be used as a cessation product. And they can't market them as a cessation product. It's illegal for them to do that. However, if you look at some of the studies, the preliminary studies are showing that there may be some benefits. However, it's still way too early, and we already do see that there are a lot of the same carcinogens present in the aerosol that's coming out of those vaping products. People call it a vapor, but it's not a vapor at all. It is an aerosol because it does contain chemicals, and some of those are cancer causing. So we see a lot of the same things coming out of e-cigarettes as we see come out of traditional tobacco cigarettes.
So what do we look at statistics-wise? I mean, obviously, I'd say 20 years ago, the statistics for people smoking was much higher than today, but maybe I'm wrong.
Well, in Nelson County, for instance, the current county health rankings show that about 20% of the adult population are still smokers. Nationwide, where that kind of puts us, about 14% on a national level, adults are smokers. So obviously, Nelson County's rates are a little bit higher than that national average. Kentucky's rates are higher too. Nelson County does fare a little bit better than Kentucky's rate. I think Kentucky stands at about 24% adult smokers, so Nelson County is faring a little bit better, but 20% is still too much.
Well, it's a lot, but what do you attribute that to? Do people actually wanting to quit smoking? Or there are laws in some counties, some cities, some buildings are obviously smoke-free. I mean, if you're going to smoke, you have to go outside.
Exactly, and that's what we're trying to do here.
Well, is it effective? I guess that's my question.
It is effective. Is those environmental kinds of strategies, the ones where you're putting a policy into place, prove to be more effective than any kind of, even any kind of quit smoking aids, to be quite honest. If we put our money and our efforts behind those preventive strategies, then we get a lot more bang for our buck that way.
So some counties, like I said, some counties in Kentucky. Now, obviously, I know there's been a push statewide because a lot of counties are. It's political. They don't. They don't want to make anybody mad.
Right.
Secondary, they're wanting. The state is wanting the county to be the bad guy, and the counties are wanting the state to be the bad guy. That way, either one of them don't have to make the tough decision. So who is going to finally break and make the tough decision?
You've got right. You know, I guess it's still kind of out there, right? Because, you know, obviously right now our state legislature is not pushing for a state law for indoor public places, you know, and that's what smoke-free policy is about. It's about indoor public places. It doesn't have anything to do with telling people that they can't smoke. You know, all it's saying is we would like for you to go outside to smoke, because obviously when you are inside an environment, an enclosed environment like that, you are going to breathe in the same air that I'm breathing in. And if you're a smoker, I'm going to be breathing in that smoke. I have that exposure. And you know, there's always the talk of, well, we can have smoking sections and non-smoking sections. It's not effective. It's proven to not be effective. So right now the push is for smaller communities to be putting in either county ordinances or a city ordinance, whichever one. Obviously, Bardstown does have a smoke-free ordinance that's been in place since 2010. Nelson County, though, that area outside of the Bardstown city limits is not protected.
Any movement in that area?
That is what we're trying to do.
Okay. Well, I know that's, again, you know, you get into the issue. I heard somebody a little while back say, well, you know, a restaurant can be a smoking restaurant. If you don't like it, you don't have to go there. But some people have to work there.
That's true.
And they don't have any, I mean, obviously they don't have to work there. They could work somewhere else. But if they choose to.
And some people don't have, you know, they don't have that choice. This is where they work, and, you know, maybe they couldn't get a job at the other place. So, you know, when we look at the amount of people in Kentucky that are protected from smoke-free policy, there is fewer than 50% of our citizens in Kentucky that are protected. And that, I feel like people should be outraged by that, because that means more than 50% of our population is not getting the same protection that the other 50% is getting.
How do you get people? How do you get politicians' attention? How do you get the government's attention? I mean, what do?
Well,
You probably walk up and down in front of the building, and
I think
protest?
there's a lot of education and awareness that has to come into play, and that's really where we're starting here in Nelson County, is to start educating people about, number one, what is a smoke-free policy? Doesn't mean that you can't smoke. We're not asking anybody to quit smoking. Although sometimes that's a great side effect that comes from a smoke-free policy, it is by no means what we're trying to do. Instead, it is educating people that, you know, when you're in an enclosed environment like that, you are exposing other people to the cigarette smoke. It's not, you know, we'll hear the slogan a lot of times, it's not the smoker, it's the smoke that's the issue. So yeah, we're going to try to do a lot of education and awareness in this community about what a smoke-free policy is and exactly why is secondhand smoke so harmful. You know, when you have people that are exposed to secondhand smoke, they're going to be at a greater risk for all of the diseases, all of the illnesses that people who are smokers have. You know, statistics show that almost half of all children that are seen in an ER for an asthma issue live in a home where they're smoking. So, I mean, that says a lot. Half of the kids that are seen in an emergency room for asthma issues are exposed to secondhand smoke on a regular basis. We could eliminate that.
So working for the health department, obviously that goes without saying, your preventive health. That's a statewide thing. Is there any progress being made? Is it Nelson County, or is there progress being made some places and better than other places?
Well, we are actually, I work in Marion, Nelson, and Washington, and we are making the push over in Marion County for a smoke-free ordinance. We just saw in Hardin County has had an ordinance for a while, E-Town has, and they have just amended their ordinance to include e-cigarettes, because a lot of the places that put ordinances in place haven't included that e-cigarette clause, and like I said earlier, that aerosol is just as harmful as the secondhand smoke. So yeah, if you talk to anybody that works for health departments across the state, that is one of the number one things that we're trying to push is for our communities to go smoke free.
So I guess it's not a scare tactic when you tell people that smoking leads to cancer. I mean, it's pretty much a definite correlation there.
Oh, yeah.
And it's not just lung cancer.
No, it is not. It is breast cancer. It is colorectal cancer. It is cervical cancer. All of those cancers, and not just cancer. You know, if you're a smoker, you do have an increased risk for heart disease, for stroke, for diabetes. You know, all of those things are increased whenever you're a smoker. And if you're breathing in secondhand smoke, your risk is increased as
So
well.
why is this such a hard sell? I mean, it just doesn't, I guess to me, and not being a smoker. I mean, obviously, and I've had a friend of mine tell me recently, he just said, you know, since I've been smoking for years, and I can't stop. He said, I really would like to stop, but so what do I do? And I really don't have the answer because not being a smoker, I can't understand where he's coming from.
You know, I mean, it's an addiction. You know, nicotine is a highly addictive drug, and tobacco companies have spent a lot of time and a lot of money into making it as addictive as they possibly can. And you know, as we saw numbers of smokers go down, the number of people that were using traditional cigarettes, now we see the tobacco companies dabbling and buying stock in what? E-cigarette companies. So, you know, they see that transition over to e-cigarettes. But, you know, it's an addictive drug, and it is so hard for people to quit. And that's unfortunate because that plays to the, you know, that part where you're like, oh my gosh, I hate to tell people where they can and can't because it's an addiction. However, that addiction should not affect.
Well, working for the health department, you have an obligation to do that.
Right.
Because, I mean, if you're in preventive health, you can't say, well, don't do this, but it's okay to do this, even though you know it's not okay to do this.
You know, we're all, everything we do is based on population health. What can we do to affect the most people? And, you know, putting in place the smoke-free laws is one thing, but we also help people with, you know, if they're trying to quit. You know, there is help for people that do want to quit. You know, studies do show it takes upwards of 10 tries for people to actually kick it. So it's tough. But, you know, whenever you look at the amount of money that's spent on smoking-related illnesses, smoking-related healthcare costs, it should really be a no-brainer for our policymakers.
Well, if somebody out there, and they do, and many people know that, where do they turn? I mean, if they want to quit and they don't know how to quit, is there groups out there to help them quit? Is there somebody to call?
Yeah, there's a lot of things out there that are available for people. Kentucky has a quit line, 1-800-QUIT-NOW, where they have certified counselors that will help people through phone messaging. They'll even do text messaging with people just to help them quit. There is also other effective strategies, nicotine replacement therapy strategies, where they can use patches or gum. There's medications out there that people can use to help them quit too. So there's a lot of resources, but I think people just have to be ready to do it.
Now, your job right now and what we're talking about today is primarily education. Not only educating politicians and government workers, but the general public, but students. I mean, there's the whole population. So you've got a coalition of some sort put together. How does somebody want to learn more about you or get more involved?
Okay, so we do have a local group that's kind of gathering back together. We're just kind of getting started again. The Bardstown Ordinance went into place in 2010, and I think there was a little bit of a push after that for Nelson County. I wasn't involved at that point, but for Nelson County to go smoke-free, but that kind of fell through. So we're kind of gearing back up again to start this process and the education and the awareness. But it is Coalition for Smoke-Free Nelson County. We are starting to meet regularly so that we can figure out what our messaging is and what our campaign strategy should be, and you know, really what do we need to do and who do we need to talk to. We are meeting. The next meeting is going to be April 30th at noon at the Nelson County Public Library, and anyone is welcome to attend. And anybody that wants more information about it can contact the Nelson County Health Department. Rachel Briney is our health strategist in Nelson County, and she has all of that information that she can share with folks that are local here.
Okay, well, again, that's the kind of information I want to get out, because I learned a long time ago there's strength in numbers.
Right.
And the more people you get to show up, the more people you get to spread your
Right.
message, the
Right.
better it is. And
Right.
we're doing our part here, obviously, here today is
Yeah.
reaching people in their homes on TV or Facebook or wherever you have to be watching this today. But
Yeah. One thing I've learned is that, 5 people that are against it can make a whole lot more noise than 1,000 people that are for it. So
Yeah.
we need those people that are for it to jump on board and help us make a little noise.
okay, well, is there anything else we need to let the world know before we get out here today? I think we've made a pretty big case that smoking's not good,
Right.
but what do we do about it, and what can we do to help? If people, it's going to extend lives, and I guess, there's nothing more scary than the word cancer to me.
Right.
I mean, and to knowing that we can prevent or at least cut back on cancer deaths, or cancer-related health. I mean, we got to do that.
Yeah, we just have to focus on the people that are working in this community that may have to work in those environments. Yeah, it is a choice for somebody to go into a business or not go into a business, but when we look at people that are, working in those environments and they're exposed to it, because they have to be, it's not fair.
Yeah.
It's not fair for them to have to be exposed to that, and there are things that we can do to help them.
If somebody came to the health department, do y'all provide patches, or what do y'all provide? Kind of counseling? What is it?
We do not provide patches at this point. It did go through the legislature, was it last year, that insurance companies now have to provide payment for, that
really?
they have to be able to pay for
I think the legislature did that,
cessation,
didn't they?
yeah, to pay for those cessation products. But we would certainly help people and give them the resources
Yeah.
that we have available to us. We don't have the patches, but we can point them in the right direction.
Okay, well, Jennifer, I do appreciate you coming in. I appreciate what you're doing. Like I said, there's a lot of people out there. The movement's got to start somewhere, and the argument that it's a money generator for the area, it's no longer valid. Years ago we had that argument, and I know you could say it based on the economy, but our farmers are not. I don't think they're the ones pushing this anymore.
No, the state spends way more money on tobacco-related illness than they generate in tobacco revenue at this point.
Yeah. So right now it's about health, and that's simply all what it's about. Your health, your family's health, the public's health in general, and again, we hope if you need help, you want help, call the health department. Marion, Nelson, Washington County,
Right.
whichever one you're listening in, and they just give the health department a call, and that's what you're all trained to do, and that's what you're doing your
right.
job.
Thank you.
All right, Jennifer Osborne here with the health department, and again, smoking cessation. Your next meeting, you say, is April 30th?
April 30th.
April 30th at Nelson County Public Library at noon. If you'd like to join in, learn more about them, call the health department and they'll point you in the right direction. So Jennifer, thank you for taking the time out of your day to do this, and wish you all the best.
Thank you.
All right, stick around. A lot more to come here on Channel 6 TV. We'll be back right after these messages.